Majority of the embryo transfers should be really completely painless. Patients shouldn't feel anything except obviously the discomfort related to the speculum, to the instrument that we insert at the beginning to expose the neck of the womb. But the moment we pass the catheter in and we release the embryo, then the really that should be completely painless. Having said that, it's not always straightforward to cannulate the neck of the womb and insert the embryo inside, and sometimes we have to use some instruments which can actually be painful for the patient, but normally we tend to associate that to some painkillers or sedation. That obviously to help the patients not to feel any pain. So that's one side of the story. In my experience, what happens sometimes is that in patients who never had any deliveries, the patients who never been pregnant, their neck of the womb can be a little bit stiff and a little bit closed, and sometimes when the catheter pass the inside of the neck of the womb, so what is called internal opening or internal os, the patients might feel like an electric shock, something like that. Feels like that. I mean, has been described to me like that, and that is a good sign in a way, because that means that the catheter is inside, is in the right place. But it is a bad sign in the sense that that electric shock means that there's been some contractions triggered in the womb. And obviously, when you trigger contractions, that means that the muscles of the womb are actually too active. And those contractions, if you transfer the embryo, those contractions might push the embryo out straight away. So it is very important then, if the patients feel pain, to stop the procedure, leaving the catheter still in, but just take a little bit of time, wait until those contractions or this kind of period pain or electric shock, whatever it's called, settle, and then transfer the embryo only when the pain is gone, because there shouldn't be any pain. It should be totally painless, really. The ultrasound helps in visualizing that you are in the right place. However, it's not very easy to visualize the contractions, the uterine contractions, by ultrasound. It can be done, but not all the machines are a level of precision. And there's been lots of studies. In fact, is one of the topics which has been very interestingly researched recently, to look at the waves of the contractions during embryo transfer, because there's been a few papers recording that the uterus contract during embryo transfer. Of course, it reacts to a foreign body, which is the catheter. So that sometimes translates into feeling pain or feeling discomfort. And as I said, it would be good to let those contractions settle and then proceed with the transfer of the embryo then.